So now how confident are you that your treatment approach works for this?
I'm confident that it works, but on each patient that I evaluate, I go in with a blank slate. I don't go in expecting to find anything. I don't go in expecting for them to have a response. I wait to be surprised. I wait to be surprised by what they say. I wait to be surprised by the area of their spine that is tender or how they move. And then I wait to be surprised by how they respond. Again, I've worked with people that they try to like incept, a better feeling into their patients. Like, oh, you're gonna feel so good, or didn't you feel good after last visit, or some similar verbiage like that. I don't wanna lead anybody anywhere. It doesn't serve me to have the patient falsely, feeling better, basically that sugar pill, right? So I know this treatment works. I know that I've had people that have had lifelong medication, that had no hope of recovery, that had life-altering symptoms completely go away, get off medication, and now living a quote-unquote normal life. But I don't think that this works for everybody. I know there's people out there that either this treatment wouldn't work for, or that maybe they do have an underlying autoimmune condition that needs some type of medication, maybe in addition to treating some supplementary symptoms coming from their spine.
So what would you tell someone who was recently diagnosed with Crohn's?
Well, let's say this. If I was recently diagnosed with Crohn's, before starting strong medication that can mess up your system, that can mess up your gut, your microbiome, your gut flora, can cause a whole host of other problems, can lead to bleeding and pain and reliance on medication. Before doing that, if you had the time and the money, I would spend 4 to 5 weeks on getting your spine properly evaluated and treated to see if you responded to this treatment. Because if so, then there's very likely a cure for your symptoms rather than just management. A cure that doesn't rely on medication, a cure that doesn't really have many, if any, side effects, and one that you're able to take into your own hands and apply to yourself and maintain throughout the rest of your life.
Are there other people who treat this way?
To my knowledge, there's really nobody else out there that treats this way. Like I said, it kind of came to it by accident. Slowly over the years, we would hear patients say when we're working on their areas of their spine that some of their symptoms would be changing that we weren't treating, like their acid reflux, like their brain fog or their dizziness. One of them would be constipation, but you didn't necessarily correlate this together. Again, they were few and farther between. Most shoulder patients aren't talking to you about their constipation, but every once in a while you hear it, and it was so infrequent that you didn't really group it well together. And then again, treating this first patient, it was just luck and opportunity that kind of came together, and the fact that she responded so well. If she didn't, I probably wouldn't be here talking about this. So unfortunately, I don't know of any other physical therapists that treat like this. I know there's chiropractors out there that have a pretty similar view in the sense of their spine can cause all of these issues, but their treatments differ. I mobilize, manipulate, so I crack your back like a chiropractor would. I don't do it to every patient, but I do it to a good amount of patients. But for my purpose, that's kind of palliative. It's passive. It makes you feel good. It makes you feel better in the moment. But if you didn't do something to maintain that improvement, to maintain or improve on the range of motion they created, to strengthen in the area that you need to strengthen in that you were weak, to keep your spine mobile in that direction, then it's just going to come back. And unfortunately, not to throw shade on chiropractors, but most of the time chiropractors, that's where they lack, is they make you feel good in the moment, but they don't really do anything to make you stay better. And that's why so many people out there have been seeing the same chiropractor for the last 3, 5, 10 years.